All right. Thank you all so much for being here today. We are excited to kick off the first part of our India Spotlight, Market Development Lens to Menstrual Health Product Access in India. This is part one of a two-part series. Before we get started, we wanted to give everybody a quick orientation to Wordly. So Wordly is an AI software that enables live translation into over 50 different languages, including several languages that are spoken in India. If you would like to access the Wordly feature, you can visit the URL that I just put in the chat. Or if you would prefer to use your smartphone to follow along, you can scan the QR code that is up on the screen. Once you enter the link using the information provided in the chat, you will be able to choose the language that you want to follow along in. So you can change the language that it's translating into if that is easier for you to follow along that way. And before we continue, I will invite my colleague Ximena to give the Wordly instructions in Spanish. So over to you, Ximena.
Gracias, Sara. Buenos días a todos los hispanohablantes que están en el webinar. Para comentarles que el webinar va a ser en inglés, pero tenemos la opción de usar un sistema de traducción de inteligencia artificial que se llama Wordly. Algunos de ustedes seguro ya lo conocen, pero para poder acceder a él van a encontrar en el chat un link que les abrirá Wordly en un navegador que tengan en su computadora, ¿no? Ustedes eligen el idioma en el que quieren leer o incluso escuchar el webinar y podrán tener la traducción en vivo de todo lo que se está diciendo, ¿no? Cualquier consulta que tengan sobre Wordly, no duden en mandarme un mensaje. Gracias.
Thank you so much, Ximena. All right, so before we get started today, we wanted to give everybody a little bit of context about this ongoing webinar series that is being hosted by RHSC along with several of our partners and members. And so this webinar today, as I said at the start of the call, is part of a two-part spotlight on India. But it's also part of a much larger learning series that RHSC's Menstrual Health Supplies Workstream and Market Development Approaches Working Group are co-hosting throughout 2024. And the idea for this joint learning series came when several of our members from the Menstrual Health Supplies Workstream and the Market Development Approaches Working Group were having conversations at our recent general membership meeting in Accra, Ghana, and have since combined to create a subgroup that is really focused on looking at market opportunities for menstrual health. And so with this joint learning series, our goal is really to support the dissemination of relevant data, evidence, key resources, and case studies of market-based approaches for menstrual health, to support better learning around market-based approaches for menstrual health, including advocacy for using market-based approaches for menstrual health. And so this India Spotlight, this two-part conversation, is our second webinar in the series. Our first was back in April, which was co-hosted with Hystra, looking at scaling access to menstrual products in the Global South. And then this second part is a two-part India Spotlight, the first part focusing more on product access, and the second part focusing more on health services. If you're ever interested in accessing any of the other webinars in this series, you can check out RHSC's Webinar Hub. The URL is listed on the chat, but you can also just navigate to rhsupplies.org and over to our webinar tab. Before we get into the conversation for today, we also wanted to provide a little bit of context around why we're hosting a webinar series, a joint learning series on market-based approaches, and really digging into why market-based approaches for menstrual health. And so to contextualize this conversation a little bit, we first wanted to start by helping to define what we mean by the menstrual health market, but also what we mean by market-based approaches to support that menstrual health market. And so the menstrual health market is really aimed at connecting the demand for and the need to manage menstrual health to a supply of products and services intended to meet that need. So really making sure that everybody that has a demand for or a need for menstrual health products and services is able to be connected efficiently and in a cost-effective way to products and services that will help meet that need. Our goal is to have a well-functioning menstrual health market that delivers equitable and sustainable access to a wide range of quality and affordable products and services to the widest possible group of those who menstruate when and where they need them. So what we mean by this is we just want to make sure that anybody who is menstruating, anybody who experiences menstruation, is able to access the products and the services that they need, and that those products and services are not only high quality, but they are also affordable and they meet the needs of the people who are using them. And so finally, to do that, we are looking at market-based approaches. And market-based approaches to menstrual health are interventions that use the interplay of supply and demand to support market actors to create a well-functioning competitive market. So really, we're looking at how do we better link those who need products and services with those who can provide those products and services kind of across the market, and then use the market to make sure that those products and services are as efficient, as cost-effective, and as high quality as possible. And so to provide us with a little bit more background and to give us our opening remarks today, I'm excited to invite Tanya Mahajan. Tanya is the co-chair of RHSC's Menstrual Health Supplies Workstream, and she is also the co-founder of Menstrual Health Action for Impact, our co-host of today's webinar and of our India Spotlight. She has over 14 years of experience in addressing systemic barriers to markets related to health products and services, and she has worked extensively at the intersection of research, programs, and advocacy for menstrual health in India as well as around the world. And so, Tanya, I will hand it over to you for our opening remarks.
Thank you so much, Sarah, for setting that context and starting us off. And welcome everyone to this conversation that we've had the good opportunity to start off today with the India Spotlight. And thanks to RHSC for helping us host this. Sarah, if we can go to the slide, please. So today I'll be using some data to present an overview of the markets for menstrual products in India, and also present some framing which will help us contextualize our conversations through our panel discussions today. Next slide, please. So just looking broadly at what is this market today. So the Indian market for menstrual products holds huge potential by the sheer size of it. It is a $3.4 billion market, and it's poised to grow to $3.5 billion by 2025. It's comprised of 368 million menstruating people, among whom access has improved significantly over the last 12 years. It was 12% in 2012, and by the latest data, as per the National Family Health Survey of India, it's 78%. The data for 2015 and 2019 is restricted to 15 to 24 years old, but still it is fairly telling in terms of the number of people who are using purpose-made products. If we take a deep dive into the data for 2019, we actually see a high level of inequity in the access that has increased over these years. So here you see on the right side of the slide a pyramid which reflects the wealth quintiles, plotted with the percentage of use of menstrual products for each wealth quintile. So on the left, you see percentage use of purpose-made products, which essentially include sanitary pads, washable pads, menstrual cups, tampons, anything that you can buy in the market. And on the right, you see non-purpose-made products, which here, as per NFHS data, refers to cloth, home-based cloth. And if you see from top to bottom, for the topmost wealth quintile, 95% of users there have access to purpose-made products, are using them, while only 54% in the last wealth quintile are using them. And if you look at non-purpose-made products, the trend is reversed. So the top wealth quintile, we have 23% users using non-purpose-made products, that's cloth, and 74% in the lowest wealth quintile. So what does this show us? What does this tell us? So this really, what this data really says is that while access has increased, it has largely been inequitable. Statistical analysis by some researchers like Karan Babbar have also shown that correlation with this wealth quintile is actually statistically significant. Additionally, this data does not include users beyond 24 years of age, for whom use of non-purpose-made products is actually likely to be higher. So the fact that a large part of the untapped market is cloth and non-purpose-made products suggests that there is a significant scope for expanding this overall pie size by offering reusable cloth products and also menstrual products, especially amongst the lowest wealth quintiles, to ensure equity. Pilot studies for reusable products and also a basket of products have actually confirmed this. The Hystra research presented during the last webinar went into this in detail, and you can access that webinar on the RHSC Webinar Hub. Another slice of data within the NFHS data also shows that much of the market for purpose-made products is disposable sanitary pads, almost 64% not accounting for locally made pads, which means that the choice for the consumer is also largely missing. So high degree of mixed use shows that there is an opportunity to work with a basket of products, and going beyond single products, and studies have shown the potential for offering basket of products as a means for increasing overall access and uptake. So in this webinar today, we are going to look at the potential for deepening the reach of these markets even further, with the objective of not just increasing access, but equitable access and more choice for the consumer. Next slide, please. This visual here represents the value chain for menstrual products and all of the various stakeholders who are engaged in the value chain to make sure that menstrual products, which is basically value for the consumer, are available to them where they need them, when they need them. At the first step, we have R&D and sourcing, which includes the development of products and materials and sourcing of raw materials for manufacture. For menstrual products, in India, these are largely globally dependent, with a lot of material coming into India, and India also exporting a lot of material. For example, textile, a lot of textile-based raw material goes out from India. So raw material suppliers, technical institutes, export agencies are all part of the stakeholder sort of group, which are relevant for this part of the value chain. If you come to manufacturing or converting the materials to a usable product, this engages multiple stakeholders to make the product ready for delivery to the final consumer. This can be at a large centralized level, at a factory level, or it can be decentralized at the village level, at the community level through decentralized manufacturing facilities. And many versions exist across that spectrum. Then we come to distribution. Distribution is the physical delivery of these products to consumers through channels that range from community-based self-help groups to large-scale pharmacy and consumer goods supply chains. Promotion next deals with the awareness of category, product, brand, everything that communicates to the consumer that this is a product available to them and creates that need or makes that need apparent to translate it into a purchase. Distribution points, mass media, frontline workers of the government, social media, all of them play a role in delivering this part of the value chain. Coming to consumers themselves, here also we have two types. You have buyers and we have users, which can be different in the case of menstrual products because of restrictions in mobility, stigma, restrictions in paying capacity, and other reasons. There are also, if we see below the value chain, various systemic facilitators that are responsible or have to be engaged to make sure that all of this happens. Quality control is a significant one, which is required to ensure safe products are available to consumers. Category awareness is needed to create first an awareness of a certain type of product, for example, reusable products. Financing across the value chain is needed to ensure that right kind of capital is available to all of the people across this value chain. And in all of this, there are enablers that cannot be ignored, including governments both as participants in the supply chain and demand chain, but also as policymakers and regulators. There are ecosystem enablers like INGOs, TA providers, media, research, academic institutes, funders from both non-profit to profit-seeking and across that spectrum. So all of these actors and stakeholders are what constitute the market, and not as maybe traditionally known as just large private sector manufacturers. And in all of this, menstrual product categories, we have broadly 4 of them: disposable pads, tampons, reusable textile-based pads, and silicone-based cups and discs. They are all at different stages of growth and maturity in terms of these different markets. Today, we have 2 panels that will explore some of the nuances of these categories, first from a product-specific lens and then from a systemic lens. So with this, let us start off with our first panel discussion of the day, which will explore the specific demand and supply challenges, opportunities, and needs from a product-specific lens. I have the pleasure of introducing the first panel that we have here today. We have with us Mr. Shivanand Bellare, who is the MD of Brahad Elastomers, which is the brand owner and manufacturer for Nari Ari menstrual cups. They're also the manufacturer for multiple other brands, including Boond, Pratham, Goli Soda, and others. We also have Mayank Jain. Mayank is the co-founder of Samarth, a grassroots organization working on agriculture value chains in rural Bihar. They are operating a decentralized model for menstrual product access within their communities, which includes both disposable pads and are also now added menstrual cups to their portfolio. We also have joining us Karthik Tangavel. Karthik is the director of Real Relief in India and is a textile engineer by training. Karthik has been closely engaged with the development of innovative and sustainable menstrual products, including the Safe Pad and Safe Panty, which are reusable textile-based products. So with this, I invite all three of our speakers to please put on their video and come online. So let's start by looking at some of the demand side challenges. First of all, the first question I have is for Shivananji. So you lead a menstrual cups company as a manufacturer supplying to other brands and as a brand owner. You've seen this category face its challenges with insertion-related myths. So according to you, how do you see this category growing in the coming years from a purely commercial perspective?
First of all, thank you, Sarah and Tanya, for inviting me as part of this panel discussion. Yes, this is actually a very interesting and very a warm heart, like, you know, very wonderful moment right now, because I think finally after 8 to 10 years of struggle, menstrual cups are finally getting the respect that it deserves, and it is becoming more than just a rich man's product or something that's available only online. Governments have recognized the usefulness of this product in terms of saving on monthly costs and logistic costs, distribution costs. And finally, governments have started a system of trying to establish standards by which menstrual cups can be brought into the proper domain. And finally, you know, they have brought menstrual cups under medical devices in the last few months. So Brahad elastomers and Nariyari, and of course, I speak for all my other customers as well. We believe in being ahead of the curve. So we have already, we are in the process of establishing a second unit with a clean room with IS 13485, where we are going to have LSR injection molded menstrual cups, which will be of the highest standards possible. And it's very heartening because today there are tenders that are being floated by state governments. And finally, we are part of the equation. Karthik has very helpfully tried to get us involved in the UN, requirements for menstrual cups. So we do work in hand with Karthik as well for that. So it's, you know, there are myths. I mean, there are myths when it comes to how a menstrual cup is used. But I think the biggest truth is period poverty. I think that's the biggest truth. And period poverty is what is going to allow every single person to look at the economics of using a product. And if you can get a menstrual cup at a reasonable cost, it really makes a difference in for the government, for the user of the product. See, we are in the cities, we don't see the waste that we created is never near us. The people in the villages are the ones who are suffering because of the landfills, with the water contamination and, you know, diseases that happen all around. So they are the ones who are facing the brunt of our use and throw policy, you know. And menstrual cups are the future. They are the future because whether it is in terms of, a product that can be used for even 5 to 8 years, a single product. And also, if you look at in terms of the fact that, you know, you don't have to wash it, you don't have to dry it. There is still some stigma when it comes to a woman, like not wanting anyone to know when it's her that time of the month. So, you know, this is a product which can be hidden away and used and, you know, very convenient for use. So finally, I think it is the time where we used to have, inquiries of 10 pieces and 100 pieces. Now we are finally coming to a stage where there are inquiries for 50,000, 1 lakh, 3 lakh pieces at a time. We have come to that maturation, and I feel it is just the beginning. I think this market is going to be such that probably you will have a requirement of maybe 100 lakh pieces within the next maybe 3-4 years. because each state government is looking at around 10-15 lakh pieces per annum. And, one state like Kerala is the one that really started this whole movement, because we supported them when the Kerala floods had hit. And they realized that the only product they could give that was usable was a menstrual cup. And that was how, it started. And now other governments have seen the success, and they're trying to replicate and running along with the idea. Thank you.
Thanks, Shivananji. And beyond just state governments, do you also see those numbers replicated in the commercial market, where direct consumers are buying, and whether it's rural, low income, or higher, that can be different. But have you seen that shift in numbers as well?
Absolutely. There is another trend that is happening, is a lot of small town pharmacies have been approaching us whether they can keep the cups at their outlets. So there is a awareness of menstrual cups even in villages. For example, my wife does outreach programs, and she was doing one in a village outside Bangalore. And she talked about reusables. She talked about, all the options. She didn't mention menstrual cups because she wasn't sure whether the audience would be ready for it. A woman just stood up and said, "Why are you not discussing about menstrual cups?" And it's her favorite topic, so she could talk a lot about it. But yes, what I mean is that there is a general shift. There is a awareness. And now I think it's just about how we are able to reach out. Women now, because of, everyone having a smartphone, is able to access information. They are able to access wise, goods, bads, everything they're able to get. It's just now that if you're able to get these products at the last, last mile, if you're able to approach that through small pharmacies, maybe through the government, PHCs, or, even the clinics, the pharmacies that are run by the government, Jan Aushadhi and all that. If we could reach that level, I think that's when, you can remove all the stigmas, and then it can really become a much bigger market than any of us can ever imagine.
Right. It has the potential to enhance equity amongst the lowest wealth quintiles. And with that, I'll move to Karthik, because I think you also deal with a product that has the potential to expand that kind of equity. So Real Relief has brought its technical strength to an erstwhile nascent category, textile-based reusables. And while today, and this I realized only last weekend, that you can order a period underwear on a speed delivery app. I was just testing it out, and it is available. This is a very recent trend. How have you seen this category grow, and what is the potential you see in both urban and rural markets, low income, high income, across the board?
Yeah, we have recently witnessed a huge potential for the reusable textile-based product. And definitely, when it comes to low-income market, definitely they need a product which they can able to easily afford. Like Shivanand mentioned, we need affordability. That's the main focus we are focusing. And since SafePad, with innovative menstrual hygiene solution, we have seen a very good growth in this sector. The reason being is, since it is a textile based product, we can able to easily pitch into the lower income area, which is a rural area, or it can be in any countries, not just India, even in India and other countries also, which is very cost effective, and it is very sustainable, where it has a very we engage women, local communities to make these pads by themselves. We call it as a local technology transfer, where we provide them the raw material of SafePad, and we engage women in the local communities. So when they start engaging themselves by making their own reusable pad, they feel much comfortable by using them. So which means once one woman is comfortable in using her own made pad, she spreads the word to other women. And the woman who tries, then that's how it goes to the grassroots level to the each and every corner of the rural area or low income areas. So that's how we can able to create the demand, where we see this is how it can able to easily generate the market, and definitely there is a big market, especially to all the sustainable product, and through our continuous innovation and education and awareness and collaboration with the local communities. Definitely, safe pad and textile based product and sustainable menstrual product have definitely a significant growth. And also we empower the women, we create job, and that's the main task, because when we provide an empowerment to a woman or a girl or a man who is supporting these menstrual hygiene products, then definitely it changes the way of their behavior, and they change into more using the sustainable menstrual product, and definitely that is the way we are seeing to increase the way of getting into the grassroots level and to the low income markets.
Right. And so community engagement is key to creating that demand at the last mile. Mayank, you operate within a category which is well established and highly competitive, which is disposable sanitary pads. And through your work with decentralized pad production, but also selling the product in low-income communities, how have you approached demand creation at a hyper-local level?
So for us, given that just for the audience, we work in the eastern part of India, and we work with very marginalized and vulnerable communities. Now, given that our nature of work, it leads us to a regular interaction with communities. So for us, getting access to some credits and some grants, it works differently as it works for corporates. So we have to work on different kind of value creation when we work directly with communities, given the very well understanding of the grassroots that we have a very limited scope of market to expand, given our depth of work and how we reach out to communities. We know our limitations, that where we have to operate. That is the first thing. Second thing, since the ethos and values what we carry when we do this kind of work, it's not just about making profits and the kind of people we have. There needs to have an attitude and mindset shift also, because at the end of the day, it's also some business aspect, not just a charity kind of a thing, even if we approach it as a service mode. That is the second point what we have. Now, given that the communities we cater to and what our experience has been, it has been seen that given, if people are aware that there is a mode called self-help groups, where women from very marginalized communities come forward, and on a monthly basis, they try to save 10 rupees or 40 rupees a month by doing their savings. So access to credit for a minuscule amount also becomes a challenge for them. Now, when we try to cater to this thing, we are very clear that it's not a charity. There has to be some accountability on part of the communities also. So we have to work on different models, which we see that it helps us in building rapport with the communities. At the same time, it helps them to be more aware about the work we do. So our sensitization and awareness goes hand in hand with promotion of products. And when we are introducing products to them, we try to ensure that we are not very partial to any one product, but we try to have a basket of informed choices. That is the first thing. Second thing is that we try to provide different models for them where they can pay for these things. So we look for the wealth creation at various aspects, and especially at the last mile connectivity. So there is one model where we talk about hub and spoke model, where we leverage the access of self-help groups when they reach out to the communities, since it becomes kind of a very close interaction between women. So that ensures safe space for the communication. At the same time, they are more open to talk about their problems in a very close space. So this is something what we do, and we try to ensure that if somebody is not able to pay, so they can go for a certain amount in an upfront value, and then they can have a credit access over a period of month or a month or two or a quarter basis thing. So that's how we look at things right now. But what we have seen, that we have to very sensibly use the grant amount, because sometimes it offsets. And given how we operate it, we have to be very critical about it. And we are very transparent about it with our communities also. So that helps us in more trust building. Yeah, thank you.
Right. So I think using grants to subsidize the product at the last mile, facilitating credit, ensuring engagement with the community through your hub and spoke model. These are all sort of ways in which you have engaged with them. But also, Mayank, you are basically, I mean, it is a bootstrap social enterprise, right? You're also profit seeking at the same time. What is the biggest challenge that you also see from a supply chain perspective on the issue of raw materials, and especially that you're working at a decentralized level?
Yes. So basically, when we see it as the decentralized model, so given that any enterprise which is just setting up, so there are same challenges because you are a manufacturing, it requires capital access. At the same time, when we are coming for raw materials, we have to source right kind of, we have to scout for right kind of vendors at the right price. We have to work on economies of scale, and we have to see how things are working. So these are typical challenges. But now, as it was also mentioned, that there are some medical compliances. Now, when we operate on sanitary pads, what happens is that every raw material in its individuality, it does not account for a medical use. So if somebody is supplying textile or something of that sort, so so they are kind of exempted from getting that compliances done. But since we are into giving a product which needs to be have a certain compliances and standard, so the onus of getting that approvals and compliances, it comes down to us, it boils down to us. So what we have seen in our interaction, a that the raw material is not very easily available, especially when we set up a machine, and given that we have a very limited knowledge and we try to deep dive, so getting right kind of sourcing at a what I would say a decent price, so that becomes very important for us. But this has been one of the major challenges for us, procuring right kind of material. So
And quality
that
probably
yeah,
also
and the
because
quality,
you're looking at a
ensuring
small.
quality at the same time.
So Karthik and Shivanand, have you also faced similar challenges in sourcing with textile related supply chains and silicon related supply chains? I see a lot of vibrant questions coming up in the chat box, and we'll come to that in a minute. But it'd be great to hear from both of you. Karthik, maybe you can take the textiles bit first. You're on mute, I think.
Yeah, when it comes to sourcing the right product, right material for textile-based, cloth pad is very much needed. The reason being is, a cloth-based product, cloth-based pads cannot be made with any available fabric. The reason being is, it all relates to the woman user. She needs to feel comfortable. She needs to, she doesn't need to fear from the leakage or the protection, and the fabric need to be hygiene. But when it comes to, our what we do is we innovate and we have the technology to, develop a specific fabric where it can match, where it can fit all these categories like innovation and comfortable, leak proof, and antimicrobial properties. Everything has been inbuilt with this safe pad during the development process. So definitely, when someone is trying to make a reusable pad, they have to take care of all these aspects. They can't just buy a fabric in the local market and then do it a cloth pad and then sell it to somebody else, because there are standards right now, and there has been mandatory standards from BIS for the cloth pad as well. Very soon it will be implemented as well. So and India is a very big textile country. So sourcing these fabrics will, in the beginning it will be difficult, but very soon it will be much easier because it's not a rocket science, and definitely people can able to easily get these textile materials by taking ideas from other brands or other companies, whoever who's supplying. So definitely there is a challenge when it comes to, because it creates competition as well. Many players in the field, and it creates competition. But anyhow, this is how we work as a team to get a sustainable menstrual product to every woman who deserves that.
Thanks, Karthik. That's helpful. Shivanand, would you like to reflect on how the sourcing for raw materials for menstrual cups I mean, what are the challenges and opportunities there, but also how I also saw a lot of questions around the cost of cups and that cheap cups can be at low quality or not. And I believe there is a certain
Yes.
linkage of the sourcing with that. So if you want to reflect on that.
Sure. Luckily, when it comes to menstrual cups, silicon is, I would say, there are, uh, of course, silicon has various grades, okay? But any serious manufacturer uses only platinum cured medical grade silicon rubber, which is made by hardly a few companies like DuPont, Wacker, and, GE, Momentive, a few, 5, 6 companies in the world manufacture platinum cured medical grade silicon rubber. What we differentiate by this is that when you use this kind of material, there are no peroxides or there is no external curing agent that is being used when the cups are being manufactured. And that itself is providing a lot of stability and safety to the end use of the cup. At the same time, as per the UNFPA, there are certain tests that need to be done, which takes months and it takes a lot of money. But we have gotten all these tests and we are very, very proactive. As and how, any requirement comes in, we always take it up as a challenge and we do these tests on our cups. It takes 6 months, 9 months at a time, but we do these tests. So our cups are tested for ISO 10993, 35, 10, 23, and 33, which is towards cytotoxicity, which is towards skin and vaginal irritation. It's towards reverse mutation of E. coli and Salmonella bacteria, which are the common things that can go wrong in using a cup. And these are taken care by these tests. And the beauty is that the materials, unfortunately, are not made in India. Silica is very specific. It's made in only a handful of 8 to 10 countries. But luckily, you have it available. There is not too much of issues in getting the correct grade of material. When you talk about the cheap cups that are coming in, that's the only problem, because as I told you, there are certain grades of silicon. So there is a non-platinum cured grade of silicon, which is meant for pharma industry. So many people use those materials and it may not harm, but it is not ideal. So, we are always worried when we are advocating about use of menstrual cup that you use the right cup. You use a branded cup, not something that you just get depending on the price of the product, because finally you cannot compromise with your health. So it's always better. And Nari has always believed that we want to bring the best cups at the best prices for anybody and everybody. So we are not an Amazon product. We are not a lifestyle product. It is meant for every single person, and our commitment is bringing the products as low as possible to everyone.
Right. So I think reducing the cost of the cup to a certain extent with your local manufacturing capabilities, but also then maintaining quality and maybe using last mile
Absolutely.
financing options, the way Mayank was saying, to provide that further affordability to go down wealth quintile.
Absolutely. You'll not imagine. We buy cups online for 400 to 800. Believe me that the government tenders are happening below 100 rupees. So,
Right.
you can imagine. So it's just that, yes, when you're giving it to one person, your advertising costs and your marketing costs and your delivery cost to a single person in anywhere of India is what really brings up the cost, individual cost of a cup. But you can get the best quality of the cup at very, very reasonable prices as long as you're ready to use it. And we are willing to work with anybody to give best quality cups at the lowest cost possible. Anyone wants to reach out, we would love to support you.
Thanks, Shivanand. And I think to the same point, Karthik, if you want to comment on a little bit about the quality that you look at in terms of sourcing the materials. We will talk about the standards a little bit more in detail in the next panel. But if you want to reflect on from a sourcing point of view, how do you ensure quality? And especially if you're doing decentralized production models, for example, how are you looking at ensuring quality there?
Quality is the main parameter, because I was just going to add another point to Shivanand, about the quality. And luckily, you also asked the same question. So quality is the main, focus for all, textile related or menstrual cup or single use product. Quality is the main parameter. And when it comes to cloth pad, we have our own, standard operating procedure when we are selecting a supplier, or when we are developing a fabric, and when we are setting up a local manufacturing unit, which is called a technology transfer. We train the women, we train the local women. They just need to know a basic tailoring, and we train from the scratch to the end, from the beginning, which means, we provide the raw material, and from there, they are in our hands by giving them proper training on the quality, on what are all the parameters they need to check, and how the flow should be, what is GMP, good manufacturing practice they need to follow in all the parameters. Like, we are doing around 9 countries with the similar technology transfer, and we also doing 2 in India. So that is how we implement through the training, through video base, or through a direct visit to the site. We train the women and we engage them. When we engage them, they feel they take the responsibility to make the pad, in a quality way. And also with the fabric, as I mentioned, there are certain parameters which the supplier need to follow, and the specification is already fixed. Wherever the pads have been made, anywhere in India or in other 9 countries, or anywhere new projects coming, the specification will be the same as made in our factory in India, or in other African countries, or in any part of India. So the quality is been, we don't compromise in quality. So quality is a big part of cloth pad, because it is very much sensitive. We are going to use it as a sensitive area, and it needs to be manufactured in a very sustainable way, as well as the product has to be more sustainable. So that's how I see, we need more quality conscious.
Thanks, Karthik. Thanks for sharing that. I see 2 sort of common threads here across all product categories. One is the need for this technical knowledge at an aggregator level for the raw material sourcing, but also how do you ensure that quality throughout the value chain, even when you're going to the decentralized markets, as that technical assistance provider. Mayank, last question for you, and 2 minutes for that, please. So all of this is also been single product focused. You are looking at now adding menstrual cups to disposable pads as a way to expand your basket of products. Can you shed a little bit of light on why you are going that pathway, and what do you see that doing for your engagement with the community?
Yeah, so just to give you a brief background, so we work, as I've told previously, we work with grassroots people, and we have a direct outreach of more than 25,000 people with whom we work. And we work right from pre-menarche girls, we interact with them, to people who have reached their menopause. So there are different age groups. If I talk about how bodies are there, so different age groups whom we are catering to. So what we have realized during our interactions, because we have been dedicatedly working from past 5 years into awareness and sensitization, where we have tried and tested for different pedagogies to reaching out to communities and getting feedback from them. So if I talk, it could be vague for somebody, but if I talk from our experiences, I cannot directly promote menstrual cup for a pre-menarche girl, given that there will be bodily changes. So at different points of time, we have to be very careful, because if we are working with the communities, we have accountability there. It's not that, because we are also one of the stakeholders, and we are in a nutshell directing them to a certain behavior, and we expect them to have that behavioral change. So what we have realized through our interactions, that there is no one size fit all solution. So when we talk about, because we have also seen in trainings and sensitization, people talk about informed choices, but when we interact with communities, it's a function of how they have been groomed. It's a function of culture, the bringing up what they are having. It's also how they interact within each other, and it's also about the access to products what they are having. So when we try to put it objectively, it comes that one solution cannot be for everyone. And since we are catering to people who have different bodily needs, there has to be different solutions proposed. So when we
Right.
go for awareness and sensitization, we try to pitch it that way only, that we are not taking final decision on your behalf. We are just telling you that these are the pros and cons of having this thing. But the final informed choice needs to be taken by you. That is the first thing. Second thing, what usually happens, what we have seen, wherever the menstrual cup pitch goes, it always talk about the landfill and the environmental impact of disposable sanitary pads. But given the diversity of communities we work in within a very district, there are multiple geographies where accessibility and other things become. So we are ensuring, when we are introducing a menstrual cup program, we have consciously targeted women of reproductive age and those who are engaged in economic activities, because we think that it makes the most suitable case. If we go by a bell curve, that 70% of our audience would like to be primarily into this category. So that's
Great.
how we take decisions. And so holistically, it looks key. We are giving informed choices kind of a thing, but there are certain categorization which we do, and accordingly we operate on with communities.
Great. Thanks, Mayank. That's really helpful to know. I think that there is also a case for responsible introduction of new products as we go about it, and also looking at not vilifying consumers for using a certain kind of product and taking choice away from them. So we thank you so much for all of your perspectives. So we are at the end of our first panel now. Thanks, Karthik, Shivanand, and Mayank for your rich insights. We'll now move to our second panel, which will look at the systemic factors. And a lot of questions came up in the chat box around standards. So standards is something that we will be talking about. We'll be talking about category awareness and financing. And we have three experts who we have here today to be reflecting on these aspects. We have with us Deep Bajaj. Deep is the co-founder of Sirona Hygiene, a femtech startup focused on menstrual health products. He has robust experience in supporting India's startup ecosystem, including investment in over 30 startups. We also have with us Aparna Ananthan. Aparna manages the healthcare and wash portfolio at Caspian Debt, which is an NBFC. She has been associated with Caspian for 4 years now, and prior to that, she worked with impact funds like MCE Social Capital and Kiva. We have with us Shivani Swami. Shivani is the Global Sales and Business Development Director for Living Art Technologies. Living Art has a reusable menstrual pad and underwear offering called Safkins, and she's been engaged with the creation of standards for reusable pads in India with BIS, and is also part of the BIS delegation to ISO for menstrual product standards. So welcome Deep, Aparna, and Shivani to this conversation. So I'll start with Deep, you today. And ask the question. So while the large FMCGs have really created the menstrual product category over the last few decades with disposable sanitary pads, it's been decidedly disposable pads. Sirona is really pushing the envelope on the menstrual care category as a whole and looking at a basket of choices. So how have you approached this? Because it has been a first mover, piece for both reusables, which is still a nascent category, and disposables, which has got a high degree of competition and has been existing for a couple of years.
Well, thank you for having me over, first of all. So how it started and why we're approaching it as a bouquet and not a one product fits all scenario is because so I started with this product called Pee Buddy. It helps women stand in pee. It was in a taboo category. It spoke to women who were suffering from lack of clean toilets in the country. That got us access to a lot of users who were willing to try newer products, and they started sharing gaps within the menstrual care category. And as we drew deeper into this, we realized that as of today, or as of back then, the whole conversation was only around saying to empower women around menstrual care needs. The only product is the pad. While when we researched, we realized that there are 4 kinds of product that she could use during her periods, and the fact that no two girls are the same, or no two women are the same, or no two menstruators are the same, and no two periods for the same menstruator are the same, we realize that rather than pushing one product, we need to understand that this because every period is different. We need to understand that she might need different products, and hence there has to be somebody who says There is pads, there is tampons, there is liners, there are cups. While in 2015, when we started, pushing menstrual cups and tampons with applicators, there was very little, availability and content around it. We realized that there were many takers who were willing to try the products as long as, you help them understand the products better. So as we see today, we realize that women face a lot of problems right from puberty to menopause. There are unaddressed categories within them, and going deeper with one product is not going to solve those challenges. So if today you've helped her once with, let's say, a tampon, and if she needs something for her white discharge, we need to ensure that panty liners are also there. If she's facing any other problem around menstrual cramps, you need to give her a holistic solution to say, hey, you can trust us. So solve it end to end. And that's the reason why Sirona looks at this problem a little differently, to say puberty to menopause, let's look at the gaps and give the choice to them, with a lot of awareness around each product.
Great. So effectively, choice has helped you create this category in a way and take it beyond just listening to the user.
In fact, for us came the last. We were, for the longest time, we were anti-pads. Now it's fun, when I say this, because a man who doesn't menstruate, I've been, asked that how can I be talking so, seriously about pads being the last on priority. But I always said that, there is enough and more around pads. What we need to break the mold is around other products, reusable pads, menstrual cups, tampons with applicators. Tampons are organic, inorganic. In a sense, there is so much of variety that somebody's got to say that the choice is yours, but the variety is here. So yes,
Right.
we are a company built purely on variety. In fact, about 4 to 5 million women today are using Sirona cups, your country's highest selling menstrual cups online. And it's only because we led with that product.
Great, great. I think that also solidifies Shivanand's point of this growing market. And coming to the other growing market, Shivani, to you with Living Guard's technology expertise, where do you see your role as a company in value creation in this ecosystem? And what has been your journey in entering this market? Because this was not the only product that was a possibility for you.
Yeah, so we are a material science company with a lot of experience working in technical textiles and textile-based solutions. And we happened to be doing a program in water, drinking water, where we went into rural India and we were doing kind of project monitoring and just understanding some of the issue areas that still kind of prevailed. And menstrual hygiene, or lack thereof, was something that kind of came about. And for us, it was very simple in the sense that we said, hey, we know textiles. Why don't we come up with a textile-based solution within this space? What we didn't realize was how challenging it could be to kind of try to get into a space that was otherwise, fairly niche in India at the time. And I'm talking like around 10 years ago, and fairly kind of silent until Padman and all those movies came around and mainstream media actually took the idea of menstruation into the mainstream. It was something that, we got a lot of cringe faces at. But for us, it was just a choice of, can we do something at the bottom of the pyramid, learn from that, and then apply those learnings across the board, even into, more top of the pyramid kind of product designs. And so I'll tell you, the first user acceptability study we did in partnership with the Indian Council of Medical Research was a disaster, because we were using white as the color. We had done stuff like for a belted version of the product that could be worn without underwear, we had gone really narrow in the middle. And here we're dealing with, people who've never seen a sanitary pad or never used a sanitary pad before. So they didn't understand the H shape. They kept asking us, why are you going thinner where we actually need the most protection, because our discharge is coming exactly there. And so it was a lot of these learnings that made us go back to the drawing board in terms of product design. Then when we finally thought, okay, we've gotten a product that has great feedback from the community, this should be easy, like let's just go and sell. And then it was the fact that affordability is an issue. Then it was, okay, let's go to the government. But at the time, there was no standard created for reusable menstrual hygiene products. And moreover, the government had just shifted from the DGSND old tendering service to also using the government e-marketplace. Everything was going digital, and they didn't have a category for a reusable product. So we had to actually work with multiple government departments. Again, there was no ownership within one single department of where menstrual hygiene and health falls. to figure out these categories. And then it was through that entire process actually that we got involved in the standards creation piece, because Living Guard has historically always been on the technical textiles and medical textiles committee for the Bureau of Standards, talking about our work in face masks and like medical apparel and other kind of applications. And so it was for us a technology-based approach, but then it was also just a lot of learning based on daily programs and people we spoke to, NGOs we interacted with, events and consortiums that we participated in. And then, today we have the first product that has IS 17514 approval, which is the standard for reusable cloth pads. And now we've kind of moved into a model in which, one, we do the finished good. So we actually have the packaged IS approved pad and panty, both reusable. The second is where we're actually utilizing the self-help group model, because we realize that in a lot of cases, the only way to get the funding to actually expand is to also include multidisciplinary facets. So having things like income generation or livelihoods being involved. So we do raw material kits where, again, all the raw material supply and quality assurance is under us. And then we supply kind of pre-cut raw material kits, and we handhold the SHGs through their entire production process, quality checking, etc. And then the third one is going back to the top of the pyramid kind of discussion, where we license out our technologies to companies to create their own products, be it in the reusable space, disposable space, and also going beyond menstrual hygiene into the incontinence or bladder leak kind of space.
Great, thanks, Shivani. So standards is obviously a space that you've gone into because of your technology expertise, and you've really played that sort of facilitator role, and you're doing that within the ISO committee also now. But what do you see the role that standards can play in actually creation of this market and expansion of this market, and making sure that products are available and accessible?
So it's a funny question, because we've been on calls where some people have also spoken about how standards actually limits innovation and marginalizes smaller companies. But I think what we need to go back to is the fact that standards are created as the lowest basic assurance that be safe for use and how it can happen. And to me, it's almost like a boilerplate or like a instruction manual that someone can use to create a product within a specific category. I'll give the context to the IS 17514, which is the reusable standards for sanitary napkins, because it looks at not only what the government requirements are in terms of product, like marking on a product packaging in terms of user instructions, date of manufacturing, etc., but it also goes into what are the best manufacturing practices that even a small scale enterprise can use to ensure that the product has minimal kind of exposure to bacteria or any like harmful contaminants. And then it also looks at what are the kind of tests that are expected to be run on a final product that allows you to then also select your raw material suppliers with a certain degree of care. When you look at any LMIC, any global south like manufacturer, it's very easy to just say, okay, they'll always be limited to a small unit or a small company and only work within the market. But you're seeing this trend of at least India becoming an export market. And the opportunity lies in actually starting from these standards and making sure when you select the absorbency requirement, when you select the kind of textile that you use, just a simple thing, and I mentioned it in the comments earlier, when you're using a reusable cloth pad, you expect it to be washed with a lot of rigor because of just the fact that it's a cloth pad that someone's used during their period. It can't have a textile that keeps kind of linting off and fluffing out. It needs to be something that remains safe throughout the use. The kind of clips and buttons that you use for clasping cannot be ferrous in nature. They shouldn't rust over time, especially because they'll be continuously wet, dry, and in humid conditions. Look, honesty, the best laid plans sometimes can go really wrong. And I think looking at standards less as a hindrance and more as just that blueprint that you can use to support you will really kind of help. And today, the standard is not mandatory for SHGs to follow, but it gives them that hope that today, if they do manage to scale the enterprise, or if they do manage to make it slightly larger, they can actually grow beyond that mom and pop kind of setup and go beyond those things. And there's government buyback schemes, or even us as a corporate, looking at some of these SHGs, if they pass quality checkings, can we support them getting their approvals in place? There are different ways that we can work, grants and stuff that can be taken to allow them to get that standard. And it's about doing, yes, one series of tests, but when you talk about product safety and what a person is using on a month-to-month basis over the better part of their lives, I think it's important that we say safety is more important.
Right. So ensuring support for safe products, but ensuring that safe products are available.
Exactly.
You also alluded to India being an exporter country, and Deep, I'll come to you with this question. You're also exporting to other regions, especially within low and middle income countries. So how do you see standards playing a role in that aspect, in making export easy or difficult? And do you see the need for harmonization, and are there other considerations when you're exporting materials or importing raw materials?
Oh, go ahead, Deep.
No, go ahead. So sorry. I thought it was my next. Please go ahead.
No, we actually did have a really tough experience trying to get our products into the Zanzibar market. So we had first shipped it to Tanzania, which is typically how most freight circles work. It goes into Tanzania and then goes onto the island of Zanzibar. And unfortunately, we had customs stop the product in Tanzania first, and then look at their own standards. And then we had customs stop it in Zanzibar again and look at their own standards. And then both issue their own levels of kind of customs clearance and duties. And so we ended up having the local NGO to clear the goods, ended up paying almost 2 to 3 times the product value just in the freight and customs. And so, we looked into it, and the reality is that there are standards across either geographies or countries, but some of them just look at what is required in terms of product performance, and then some look at safety as well as product performance, some look at safety, product performance, as well as manufacturing practices. And so there is a big variety. I think, the importance of ISO coming together, and ISO has actually come together and created a panel which is working on harmonized standards globally for internal and external single-use and multiple-use products. And that actually will allow companies like Sirona and Living Guard and Real Relief to use that same product design and go beyond borders with a lot more ease, without having to be worried that, hey, today in this country, they might have an issue because my literally, like, the metrology requirements in India differed from the metrology requirements of product packaging for Zanzibar. And so we had to create a whole new packaging style for that country. And while issues like that might still crop up from local regulations that will override these standards, stuff like the length or the absorbency, the safety characteristics, the cytotoxicity, all of that then becomes just common. And it actually allows for companies to have that exponential growth.
Would you like to add anything to that?
Don't want to spoil it.
Okay.
She said it really well.
Great. So we'll move to Aparna then. Aparna, so you have seen all of our speakers, also share the opportunities, challenges from a product perspective. Looking at the value chain, there are needs for different types of financing across. Can you give us an overview of the types of socially motivated capital that should look at menstrual health enterprises and that are and are not currently?
Thanks, Tanya. Yeah, it's a little bit different from the rest of the conversation, but yet an important one, right? So when you talk about socially motivated capital, generally what we consider is funding where returns are not that important, right? And typically, if you look at the type of products there, one of the easiest product is grants, right? You're raising grants from philanthropic funds or through CSR, from corporates. That's one form of capital which early stage companies can look at when they are in the product development stage, right? Second, you also have something called as returnable grant. That is, you use the grant for a couple of years till your product becomes commercially viable, and then you return it back to the fund, and the fund keeps revolving it, right? So that's also one kind of fund where not much of returns is expected by the particular fund, right? Now, another form of capital which has been coming up recently in the past has been something called as blended finance, right? Now, this is a newer type of product where the philanthropic capital and commercial capital meet in between, right? Because philanthropic capital generally do not look for returns, right? So they can act as a support to commercial funds to invest in very high impact companies, which otherwise the commercial funds would not invest in, right? So it is kind of de-risking whatever risks are existing in the particular company or in the particular sector, right? So this is also some kind of financing which is coming up, and we've seen a couple of transactions happening on the healthcare side, on the food and agri side. So again, a product which is good to explore on the menstrual side as well, and see if there is something that can be made out of it. So I think these are a few products specifically from the socially motivated capital. Of course, there are other equity and debt, but they are all more focused on, there are definitely returns there. But from socially motivated capital, I would say these are a few products which can be looked at.
Sure. And Caspian particularly deals in debt financing. So which type of enterprises do you think are ready to receive that kind of capital? And what do enterprises need to do? What can they do to make sure that they're ready to receive such kind of funding in the future if they are not ready today?
Right. So typically, if you see early stage companies, for early stage companies, equity is the most sought out option, right? And that is also the right option at the very initial stages. But definitely for certain companies, debt can be a very good product. As an entrepreneur, it is important to know and understand when you should be raising debt and when you should be raising equity, right? So for whenever we talk to any startups and if they ask the question, when is the right time for us to raise debt? We just tell them one sentence that whenever you have a predictable cash flow coming in, that is the right time for you to raise debt. In all the other situations, equity is a better option. Now, why would I say cash flow is? Because, see, equity is definitely a long-term funding and more patient capital. But when you are onboarding debt comes with a agreed repayment schedule. The repayment schedule can definitely be customized based on your cash flows, but there has to be still some cash flows that are coming in for you to service that debt because you're contractually obligated to do that, right? Which is why it is important that you are generating some form of cash flow to ensure that you can service those repayments, right? So ideally, equity is generally when you're developing a new product or whenever you want to spend on creating that first couple of cycles or generating the first couple of cycles of revenue. Equity is something which is a good product for you at that point of time. But once you know that you've done a few sales already in the past, you know that there is definitely cash flow that is going to come in and you need money for inventory, etc. Debt is definitely a better option, right? So that's how I would say from the perspective of defining when to use equity, when to use debt is it will be good for entrepreneurs to know that because you wouldn't want to use your equity money for working capital when you know that your working capital funding can be fulfilled through a debt source. And like everyone knows, one of the biggest advantage of debt financing is it's non-dilutive capital. So you're not diluting your share, right? And definitely cost of equity is definitely higher than cost of debt. So you wouldn't want to unnecessarily use your equity money for a working capital need when you can use that mainly for your growth purposes or for developing new products, right? So that would be definitely from the perspective of who should be raising or when you should be raising debt. With the perspective of what or how should enterprise get ready for securing debt, right? So a lot of companies may not be ready at this point of time, but there's definitely scope of raising debt and equity if you, scope of raising debt in the future if you prepare yourself for certain aspects, right? Now, if you see in debt products as well, there are different products. To just give you an example, there is collateral-backed product wherein there is some form of collateral that is backing the debt. So basically, in those cases, lenders will look at your business model, but additionally, they lay more emphasis on your collateral because if something goes wrong, they want to see if the collateral is enough, to get their money back. Then there is another form of capital where we provide collateral-free loans. So Caspian Debt is one of those players providing collateral-free loans, right? So when you're talking about collateral-free loans, how do we analyze companies, evaluate companies? Is we look at the business model. We look at a lot of depth of the business model, because that is what is going to help us gauge whether the company is going to repay the money or not, right? So one of the aspects is, I'll talk about it in two parts: what generally such companies evaluate, and what are the shortcomings we've seen in a few startups, and what they can work towards in order to get debt in the future. So typically, if you see in companies like Caspian Debt or other debt players in the market who provide collateral-free debt, they basically, on the broader level, focus on four important aspects, right? One is your governance and management. So they try and ensure that you have a proper functioning board, and then your management, the founder team, as well as your senior line of management are experienced to run the business. So that's at a broader level, which generally they look at. Second is on the business operations. Everything about a business operation, right from a supply chain, customers, etc., is something that is looked at in very detail. Third is your systems and processes in terms of whether you prepare your MIS, whether your credit bureau checks are in place, etc. I'll talk a little bit more about this in the next few minutes. And the last is obviously the financial performance, wherein you look at growth, wherein you're looking at margins, leverage, etc. All the financial performance is looked at. So these are the four generally broader categories which debt players look at when they're evaluating any company, right? Now, where we've seen startups lacking amongst these four parameters, most of them, is on the processes and systems side, right? A lot of times what happens is when you're at an initial stage, you tend to focus more on the product, on the operations, and at times the systems take a backseat, right? So we've seen, or we've worked, for example, we've seen companies who don't have a basic MIS system in place, right? And it's difficult for us to fund such companies where there is no MIS system. Second, credit bureau check, you find that a lot of companies don't have a clean credit report, which is again very important when you're raising debt. And not only the credit report of the company, but also of the founders, right? Especially if you're raising debt for the first time, they say that founders are, or the companies are the extension of the founders, right? So if the founders' credit report is clean, generally it is assumed that, they will ensure that they will also repay the debt of the company regularly as well. So it's also important that your personal CIBIL or your, personal credit report is also clean. Third, again, like we've said, statutory compliance in terms of taxes, GST, all these need to be in place. A lot of these may sound boring to a lot of people, but these are certain important factors which can also help you scale at certain point of time, right? So these are the things which your initial companies should also be looking at. And last, one of the things which we've also found is that the finance function generally of early stage companies are not very strong. Again, because the focus is not much on the finance part of it, recording of the transactions, understanding different financial products which are suitable for the company. All these can help if you have a finance, not like a big finance team, but at least someone to manage your finances and guide you as well, right? So I think ultimately it's not about having just one product. It's about having both equity and debt and finding that perfect balance between the two, right? So I think these are some of the things which startups can conclude.
Absolutely. Thanks, Aparna. I think that focus on process initially in balance with product is very well noted. There is a question in the chat box. Unfortunately, we don't have the time to take it, but please do look at it from Sumati, which is very interesting. I think it will be useful to answer. And Deep and Shivani, if you guys can also add in the chat box, what's your experience been with raising finance for your companies, and how you have looked at capital for yourself, that will be great. As well. So with that, I'll move to our closing remarks for the day. Thank you so much for a rich and vibrant discussion. I would now like to invite Adrian Dongus to reflect on these conversations and offer closing remarks with where he sees the opportunities in the Indian menstrual product market. Adrian has extensive experience in market-based approaches and menstrual health and hygiene. At the Sanitation and Hygiene Fund, he leads the development and rollout of a global menstrual health and hygiene strategy to realize the fund's vision of transforming the way people access menstrual products through markets across LMICs. So Adrian, over to you to deliver closing remarks for our session today.
Thank you very much, Tanya. And I want to thank all the speakers today who are here. I've heard some really incredible insights on the different efforts that are being put forward here in India to help drive product access through markets. And to come back to the message that Sarah shared all the way at the beginning, I think that if the aim of many of the people on this call today and many of the other individuals and organizations that are trying to drive access to a range of quality, affordable menstrual products through markets, then what we really need to do is we need to look at these markets specifically and say, okay, review them closely. What are the changes that are needed and what things do need to be improved? And that really means looking at all facets of this market. And the different speakers have spoken to different components of that. Broadly speaking, you could categorize them into three different areas. There is incredible need to look at the policy and regulatory environment, the enabling environment that really allows entrepreneurs and enterprises to start, develop, introduce, and then build scalable models that bring these different products to market and bring them to consumers. We need to look at how we can support different entrepreneurs in the different challenges that they're facing, from strengthening the technical components and the innovative solutions that we've heard about from a product point of view, but also how do we look at developing the right types of business models that companies are using to get these products to the end user through the supply chain, and then providing the different types of capital, more risk tolerant and more commercial, all going hand in hand to make sure that the financial resources are available to these companies to then provide access at scale. And I want to highlight a few components around this. We spoke about a lot of different things today. One of the things that is really important to note when it comes to the regulatory and policy environment, there are two different approaches going side by side, and market-based approaches are not replacing free distribution or subsidized distribution of product, but we do need to be very clear when we use them, because entrepreneurs and enterprises are going to be affected by free distribution if they're not happening in a targeted way. So policies from national governments should have very clear statements around where market-based solutions can cover the need of hundreds of millions of women and girls across low and middle income countries, and then specifically talk about in which instances free and subsidized models can come in to target the most vulnerable or to target people in, for example, humanitarian context. And I would like to also point to the numbers that are coming out from RHSC soon, a new LEAP report. But really the scale, 500-600 million women and girls today, that's never going to be a solution driven by free access alone. The money isn't there. Government, grant, philanthropic, foreign donors. It is going to be, for the vast majority, going to happen through markets offering better and more affordable products. Standards within that, I think India is a really great example where you've seen different actions being taken by the government to put in place product standards for reusable pads, classifying menstrual cups within a specific category. But there's still more work to be done. There have been reflections on the role of ISO, but especially for India as a country that's not only manufacturing for its domestic market, but that plays a huge role, especially as newer product options are going to be introduced in new markets. The role of India and the advocates and the companies in India to really strengthen and support the development of global standards at ISO and bring in the other countries. Because when we get to finalized standards by 2026, we still need all of these countries across high, low, and middle income countries to adopt these standards. And only once the adoption is completed can we really say that the market is shifting. I do want to stress that these standards really do not hamper design and innovation. Today, standards are looking much more at what are the basic minimum requirements in terms of the function and the safety, where we move away from descriptions on the types of materials that should be used, rather to look at what are the types of minimum requirements on, for example, the safety side, the irritation side, long-term health effects that a material used in a product should meet. So it just means as long as you come up with a new product or a great material you want to use, and it's safe or it performs the basic function of collecting or absorbing the right amount of menstrual flow, innovation can still thrive with these new standards that are coming on board. From an investment point of view as well, we as SHF are looking closely at how companies can attract investment, and standards will bring the companies we've heard today and many others that are operating in this market outside of a regulatory gray area and make these products and thereby the companies recognized, certified, and therefore also more investable and more bankable. It is very hard to justify a larger investment in a company whose product is unregulated. So there's a lot of things to be said for that. There are similar areas where I'm sure many of these companies today are struggling, or at least facing challenges when it comes to taxes, levies, duties, and fees that are imposed by different governments when you're trying to export your products abroad. But also looking at how documentation requirements at the point of exit, at a port in India, as well as the point of entry where you're exporting your products to a third country, if these requirements and these documentations are aligned, it will allow not only for domestic markets to thrive, but for regional markets and potentially global markets, so that the newer products we've heard about today can grow into regional and global powerhouses the way we've seen for the other areas. When we look at the development of the private sector, I think there were a couple of conversations I thought were very interesting. One was around the unit economics, and we often tend to focus on the unit economics for demand, for production. And here to say that for certain product categories, like single-use disposable pads, probably got a very, very long way already. And while there are areas where we can still try and improve, we actually faced with other challenges around the cost of the raw material inputs that are actually going up under the pressures of global demand for materials, influence of climate change on the cost of wood pulp and other materials as well. But there's another really important piece to look at, and that's actually the cost, the unit economics for demand generation. The new products we're talking about now, and they're not really new, cups have been around for decades, but the ones that are picking up steam today, they are fundamentally different because these are not really fast-moving consumer goods anymore. When you're selling a menstrual cup that a user is going to buy once every 5 to 10 years, the business case is different for the manufacturer. It's different for the wholesaler who's moving the product through the value chain, and it's going to be very different for the retailer who's going to sell that product. So we will likely not see the same types of menstrual products on the same shelves. I know very well in different parts of East and West Africa, and I'm sure this is similar in different regions in India, you might be able to buy pads as a pack or even sold as individual units next to cooking oil, sugar, basic inputs that households need at the smallest shops. A menstrual cup will likely never reach that. It requires a different space to be sold, and also the revenues that go with that and the marketing costs that we have for every individual user who's converted to this product is very different. If the annual cost of a year supply of single-use pads is around $25 and you take 10% for marketing, you have $2.50 to spend to convince that individual user to use your product for the next year. And with assuming a menstrual cup in India costs between $5 to $10, and Deep can correct me here, but even if it is $10, and that cup is going to be used for the next 5 years, you have an annual revenue of $2 per user per year, so only 20 cents. So you're looking at less than 10% of the marketing cost. So if we have less money available to convince a user to use a cup, then how are we going to find the most cost-effective way to convince someone and to inform someone that this option exists, that it's a safe and quality option, and then get them to a point of sale where they can use it? I think these are some of the really important challenges that the different enterprises are going to have to work on. When we look at finance, and I've seen some really interesting comments today, and thank you very much for that. I think there's a few things I want to highlight, but more from the perspective of the market, because there have been great examples mentioned around the need for investment, around the need for working capital loans, but what will they be used for? And here you see an important interaction in the value chain. So when we look at the manufacturers and we look at the brands that are selling these products, they engage with a broader ecosystem of market players, a wholesaler or a distributor, or maybe the owner of a pharmacy chain owns 20, 30 stores. They will need to buy these products from the brand that they're interested in. And when they do that, very often these products need to come on consignment. They are not going to be paid for in advance. And that means as menstrual product companies, you're going to need access to debt financing, a working capital loan. What does that mean? It just means that you can pay from a bank loan for the amount of money that you need to put that product on the shelf until your partner that you're working with has managed to sell that product and has it moved off the shelf. That you also have the money upfront to invest in some of the demand generating strategies to help that retailer or to help that wholesaler move that product to the end consumer. At the consumer level, I heard a few mentions here of forms of microfinance. But what we didn't really talk about is that while reusable options are significantly more affordable over the lifetime, the upfront cost, the amount of money I need to take out of my pocket to pay for it, is usually higher or significantly higher. So are there ways in which companies can collaborate with microfinance institutions or through saving and loan programs to help to pre-finance the upfront cost? And from some of the research that we've done to understand how that is structured, it will likely be difficult to do that for a menstrual product on its own, but there are great opportunities, for example, to include menstrual products within a microfinance loan when it comes to back to school loans. There are examples of organizations like One Acre Fund that have done that as part of a basket of agricultural inputs, targeting specifically women who tend to crops who are smallholder farmers. There's a range of different options that are available, but we do need to pick that up even further. And then at the level of financial institutions, there is a role for both public funders, philanthropic organizations, DFIs, and others to really come in at the early stage. Funds like ourselves need to come in and take the responsibility and provide some of the grant funding and some of the catalytic grant funding required to take away the risk that a private investor cannot take. We are currently in the process of funding at different levels the work that's going to lead towards the development of the international ISO standards. And that's not a type of investment you can expect from a private sector company or an investor. But even if we get to the point that someone like Deep is scaling up Sirona, but there is maybe still some questions from the funders, the investors, in terms of the model and whether it can really prove itself at scale. Having a few grant funders behind them to say, well, we can offer a specific product to help de-risk the investment or to offer an interest rate reduction on a loan. Those are the kind of things and the kind of support that we need to see coming from a much wider group of international donors, funders, and philanthropists, so that this market can scale up a lot faster. Because I have no doubt that this market is going to develop. But the thing we want to solve is we want to develop it faster, because every day we wait is a day where hundreds of millions of people are going without product. When we have the technology, we pretty much understand how to bring products to market, and we have a decent understanding of how to provide information that will allow girls and women to make an informed choice. So with the right financing and with the efforts we've seen today, we can make it happen a lot faster. And I think that that's the task ahead for everybody on the panel today and for everyone that's been listening. So yeah, I'd say keep joining these sessions by RHSC and the Menstrual Health Supplies Workstream, and I'm sure some of the answers will be provided. I'll leave it at that for now and happy to engage bilaterally if others are interested.
Thank you so much, Adrian. Thank you for summarizing your reflections from this discussion that we had today. I think we managed to basically touch the tip of the iceberg today with a little bit of everything, and there's scope to definitely go deeper into all of these issues. And we are happy to do that. And thank you for also facilitating these conversations and bringing them up in the Reproductive Health Supplies Coalition Menstrual Health Workstream. If anyone's interested to join the workstream, please feel free to reach out to me or Sarah or anyone at RHSC directly, and we'll help that, because we are helping, or we are supporting the formulation of what market-based approaches mean, and where can investments really come in, and trying to really see how this ecosystem can be facilitated from a lot of the angles that we have seen today: quality, financing, capacity building for social enterprises, and so much more. I will close here, say thank you to all of you, and hand it back to Sarah for closing out the session today. And hopefully you can join us for the next session next week.
Awesome. Thank you so much, Tanya. I will keep this quick since I know we are at time, but I want to say a huge thank you to all of our incredible speakers today. I think as Tanya and Adrian both just said, you did an excellent job representing different parts of the market and value chain in India. And this is certainly just the tip of the iceberg. So we do hope to continue these conversations. I would also like to extend a huge thank you to Tanya with Menstrual Health Action for Impact, our co-hosts of today's webinar. They were really the thought leaders and brain power behind this one, so a huge thank you to both of you. And please do join us for part 2 next week. We'll be looking at health services and integration of menstrual health with health services in India. I put the link in the chat, so please do register there. And then if you sign up for the RHSC Menstrual Health Supplies Workstream, we always circulate our webinars there as well. Thank you all for joining, and have a great rest of the evening or of the day, depending on where you are in the world. Thank you so much, everybody.
Thank you all.